help your child recover after surgery, the anesthesiologists at Texas Children's Hospital can place a continuous nerve block catheter to relieve pain. This catheter system can be used at home to make your child more comfortable. This brief video will introduce you to the nerve block procedure by answering the following questions. What is a nerve block? Why use a nerve block? How is a nerve block catheter placed? What should my child expect after a nerve block? How is the catheter removed? And what are the risks of a continuous nerve block and when to call for help? A nerve block involves a precise injection of a numbing medication called local anesthetic around nerves close to the surgical site to reduce pain. In children, this is usually done after the patient is asleep under general anesthesia. A small plastic tube, or catheter, will be placed next to the nerve so an infusion pump can deliver the local anesthetic medication continuously and make the nerve block last up to 48 hours after surgery. For procedures involving the upper extremities, a block of the nerve bundle called the brachial plexus is commonly done. Depending on where the local anesthetic and catheter is placed along the brachial plexus, excellent pain control can be achieved over the shoulder, elbow, forearm, and hand. For procedures involving the lower extremities, a nerve block catheter can be placed near the femoral or sciatic nerves. A femoral nerve block will make the front of the thigh, top of the knee, and inner part of the calf down to the ankle feel numb. A sciatic nerve block will make the back of the thigh and knee, along with most of the calf, foot, and toes feel numb. Relief of pain associated with surgery is the most common reason to perform a nerve block. Anesthesiologists at Texas Children's will also occasionally do the procedure for children with certain pain syndromes that are not adequately controlled by everyday treatments. Research has proven the safety and usefulness of nerve blockade for pain control after surgery. Specifically, nerve blocks provide a high quality and steady pain control for a long period, reduce the need for oral pain medication, reduce the side effects of oral pain medication such as nausea, itching, constipation, dizziness, and sleepiness, and also allow for earlier mobilization of the affected limb and easier physical therapy. While nerve blocks are very effective, there are some limitations to be aware of. A nerve block will not necessarily make your child completely pain-free, and having pain does not mean the block is not helping. Sometimes the spread of local anesthetic around the nerve is not perfect, or the area of the surgery may be partially covered by a nerve that was not blocked. These factors can contribute to pain, and your child's doctor will prescribe oral pain medications to help with this. Remember to fill these medications before you go home. Prior to surgery, you will meet your child's anesthesia team, who will perform a thorough evaluation and describe the plan for anesthesia, as well as the nerve block procedure. After your child is brought to the operating room, he or she will safely go to sleep. The anesthesiologist will get ready for the nerve block by first cleaning the skin and arranging sterile towels around the site. An ultrasound probe is then placed gently on the skin to identify the nerve to be blocked. A needle is inserted into position near the nerve. Next, a thin plastic catheter is threaded through the needle. The needle is then removed, leaving the catheter inside. Local anesthetic medication is then injected through the catheter to start the nerve block. The catheter is then secured to the skin and covered with a dressing to protect it and hold it in place. After surgery, a battery-operated pump will be attached to the catheter hub. The pump delivers local anesthetic solution from a medication bag through the pump tubing down the length of the catheter to surround the nerve. The anesthesiologist will program the pump to deliver a prescribed amount of medication per hour, and you will not need to change this. The anesthesiologist may also program the large circular button on the front of the pump to deliver a boost of extra medication when pressed. This can be useful for any breakthrough pain your child may experience. The infusion pump and medication bag are then packed into a belt pack for ease of handling. Your child will have numbness in the area of the body supplied by the blocked nerve. This is normal and will go away once the nerve block wears off. It is important to protect the numb arm or leg because your child can accidentally injure him or herself and not realize it. Use a sling or brace to hold the limb steady and close to the body. Along with numbness, nerve blocks can produce some degree of weakness. With modern local anesthetic medications, this tends to be less of a problem, but may still occur. If your child had a nerve block of the leg, he or she should not try to bear weight while the nerve block is present. Rather, ensure your child uses crutches while moving about. And always follow any activity restrictions prescribed by the surgeon. In addition to numbness and mild weakness, your child may experience some tingling or pins and needles sensations, particularly when the nerve block is wearing off. For arm blocks, especially those done for shoulder surgery, it is not unusual to see the following: a feeling like it is harder to take a deep breath, unequal pupils, a drooping eyelid on the side of the block, or a stuffy nose. These symptoms are usually not troublesome and will go away when the nerve block wears off. Removal of the catheter at home is easy and only takes a minute or so. Prior to going home, you will be told the approximate day and time the local anesthetic medication will run out. In general, you may expect the medication in the infusion bag to last approximately 40 to 48 hours. You will know the infusion has ended when the medication bag becomes empty. At this time, you should turn the infusion pump off by turning the knob at the base and remove the catheter. In this model, removal of the catheter is demonstrated. The catheter is seen here, and the overlying dressing here. First, peel back the edges of the dressing overlying the catheter and remove. Hold the catheter where it enters the skin and gently pull it out. It should come out easily with minimal resistance or discomfort. If there is resistance, stop and call the number on your nerve block information handout for help. Place the infusion pump, catheter, pump tubing, and empty medication bag in the trash. If there is leftover medication in the medication bag or pump tubing, do not try to remove it. This medication is a local anesthetic only. There is no narcotic in it, and it is not for oral or intravenous use. Expect your child to have full return of normal sensation over the next several hours following catheter removal. He or she can take oral pain medications for pain relief if needed. Use of peripheral nerve block catheters is very safe, and complications are rare. Risks of this procedure include failed block or inadequate pain relief, bleeding, infection, numbness or weakness that does not go away, seizure, heart palpitations, and allergic reaction to the local anesthetic medication. Within 48 hours of going home, you will receive a follow-up call from your child's anesthesiologist or the Texas Children's Acute Pain Service to evaluate the quality of pain control and answer any questions you may have. However, if at any time you become concerned about your child's nerve block, or just have a question about it, do not hesitate to call the number provided on your information sheet. The anesthesiologists at Texas Children's Hospital are available 24 hours a day, 7 days a week, and are happy to help. Thank you for watching, and we hope we can help make you and your child's upcoming experience easier and more comfortable.